We're here today to talk a little bit about the lead poisoning prevention remediation report that we're putting out in collaboration with a number of with the lead task force. I just want to welcome everybody for coming. We're going to hear from a number of folks that helped put the report together, a number of the various partners throughout the county that have been stepping forward to take the lead on this issue of lead poisoning in our community. So I'll give a little overview of sort of how we got to where we are today, and then I'm going to turn it over to Jim Rutherford from the Health Officer for the Calhoun County Public Health Department to walk us through some of the goals. He'll be followed by Melinda Hautau, Head Start nurse with Community Action, Audra Brummel, who's a health educator from the Calhoun County Public Health Department, and then Helen Guzzo, who's from the Community Development Department from the City of Battle Creek. And they'll walk us through some of the goals of the plan, and then we'll hear some examples of how the plan or the report that we're putting out is serving as a resource for families and for agencies in Calhoun County on the subject of lead poisoning. Paul Mikowski, the Environmental Health Manager from the Calhoun County Public Health Department, will give us some examples of how that document can be used as a resource. About January of 2016, we reconstituted a lead task force in the county. This was happening at about the same time that the issues in Flint with the lead poisoning in the water were coming to light, becoming a big issue. But there were other things that helped lead us to this point. At the city, we have a responsibility to report to HUD on lead activities. We know that lead paint and housing is a big concern. We do lead remediation work, and we wanted to reach out and connect with other partners in the county to see if we couldn't do something more intentional around the issues of lead. Likewise, at the county, the Calhoun County Health Department was concerned about the low number of children under the age of 6 being tested throughout the county, and wanted to be doing more to see if we couldn't be testing more children. So when we came together, there was a great deal of energy around information sharing about what various folks were doing. A number of different municipalities, including the Village of Homer, City of Albion, and others, came, and we did a lot of information sharing. But fairly quickly, we decided that we needed something that would help paint the picture of the problem in Flint, set us apart from what's happening. In Calhoun County, set us apart from what's happening in Flint, and help organize our efforts to address lead in our community. So we have, over the course of the last 5 years, over 300 children have tested positive for elevated blood levels. So we do have an issue. We don't want to be alarmist about it, but we do want to present folks with information about how we can address that problem and reduce those numbers.